Welcome, I'm Dr. Cynthia Salter-Lewis, and today we're going to do a demonstration of Juvederm Voluma. We have our patient here, and I just want to show you just a few things. Juvederm Voluma is FDA approved for the mid-face, for providing some mid-face volume. As we age, we begin to lose volume just right here along the zygoma, or what you know as the cheekbone. We begin to get some flattening here, we get some skeletal loss here, and that goes along with the aging process. And sometimes you see patients who say, well, I feel like I'm starting to droop, and that's basically because of the volume loss from the collagen. So here we have our patient, and she's beautiful. She has just a little bit of volume loss here and just along here. And what we want to do with the Juvederm Voluma is to just lift her mid-face, just like that, right along the zygoma. So that way her vector is now pointing upward instead of downward, okay? So we're going to get started here. The injection doesn't take very long at all. We did do some preparation. She had some topical anesthetic. We've cleaned that off already, and we're going to do a little bit more cleaning. And then we're going to do the Juvederm Voluma. What I do like to do is actually to draw on the face of the patient, just so I can prevent going into certain areas where there are important vessels and nerves. So we're going to do just a little drawing here. Now, with our injection, it's very important that we're just above bone, and we like to aspirate just a little, just to make sure we're not in any type of vessel that we shouldn't be in, and then we inject, okay? And I'm going to inject right along her zygoma. I like to inject laterally or on her side in order to prevent that filling anteriorly. If you inject the cheeks anteriorly or in the front, that's when you have that golf ball look, and it doesn't look as natural. So in order to create a more natural appearance, which is very important, you go along with the natural zygomatic arch and you inject laterally. So we're going to inject. Sometimes I like to pull the skin back how I want it to look, in other words. How are you doing? You doing okay? Straight face for me. There we go. As you can see, the nice thing is that you don't have too much bleeding or bruising when you actually do the cheek. As you can see, she had some slight volume deficit, if you could turn your head that way, just a little, right in here. Fill that in there. And if you compare it to the other side, here you go. You can just see that's a little flatter. You have some volume deficit, which is corrected on this side. Now, if you look at our patient here, you can clearly see a change in vector. Right side, right along the zygoma on the right side, her vector is now projecting upward instead of downward. Look at the left side, you see how flattened that is with volume loss, and it's a downward projection because of the collagen loss. So our aim today for this side is to do the same thing as on the right side. But I just wanted you to see the difference there. It's pretty remarkable. So we'll do the same technique. So now we're all done with our patients, and we filled in some deficits here along the zygoma. And as you can see, when you fill in those deficits laterally, it actually changes the vector of the face. And even the volume loss below her eye that was in her tear trough area is actually improved, and I did not inject that area. However, when you put volume in the mid-face and you change the vector of the face and you correct the volume loss along the zygoma, it actually pulls laterally and improves the eye area as well. So when you see her before and her afters, you'll notice that although we injected here, this whole mid-face is actually improved. As a matter of fact, it even improved slightly her nasolabial folds as well. And that's all with bringing up her cheeks and correcting some of the volume loss. She had volume loss here, along her zygomatic arch here, and in her mid-face on both sides, and that's all totally corrected. Okay, so we're changing the way that we're thinking now in the filler world, which is before, when we did not have anything that was FDA approved for the mid-face. We would only fill in here and here, but yet you still had the volume loss here. Now that we have something approved for the mid-face, we can correct it in the mid-face, and that actually starts correcting some of the other areas as well. So with my patients, they still may need filler here in the nasolabial folds and here in the marionettes, but sometimes they can now use less filler in those areas. Lastly, it creates a more natural look. How you doing? You doing okay?
I'm doing great.
Well, thank you so much.
Thank you.
For being such a wonderful patient. I'm Dr. Cynthia Salter-Lewis. Thank you so much for joining us for our Voluma demonstration.